Hello? Ladicia, what on, girl?
Teresa, a long time I not hear from you, no girl, but wait, you dash me away now.
No man no say that. No send me dash you away. Girl, me there me no feel well. Me I tell you say some blisters and something come up on my skin look like me get chicken pox.
You catch what? Chicken pox? Lord Jesus, girl.
If you see how the bump them look awful, girl.
Oh God. I'm sorry for hear, girl. I'm really sorry for hear. So bump on something up on your face. Oh God, that's what me hear. So people will catch you bump on something up on your face or something.
Me no know how me catch it, you know. Me can't believe say them stuff may happen to me.
Then me can go see if you know.
Oh yeah, go see me. Look for my skin, me look like polka dot. Me don't know if them something I go spoil up my nice clean skin.
Lord Jesus. But here a girl, me know a nurse. She named Nurse Simit. Me gonna give you her number. Me gonna send it on WhatsApp right now. Yeah, so just call her and tell her everything we are going with you.
Alright, yeah man, send me her number and I'll give her a call.
And she will fix your problem, girl. Yes, girl. Alright, so just let me know if you get through. Me gonna send your number now, yeah?
Alright, thanks.
Hi, good afternoon, Nurse Smith's office.
Hello, Nurse Smith. Good afternoon. Yes, I was given your number by Miss Golding. She said you could be of some assistance to me because I'm having the chicken pox. And I'm so stressed out about it, nurse. I don't know what to do with all these blisters and I don't know how I contracted this virus and how to get rid of it. I'm wondering if you could be of any assistance to me with this matter.
Oh, you have contracted chicken pox. I'm really sorry to hear that. Yes, I can definitely be of some assistance to you today. I'll just let you know a little bit about what chicken pox is all about, okay? So chicken pox is caused by the Varicella Zoster virus and it is highly contagious. So it takes about 2 weeks for the person to develop the virus once they come in contact with it. Chickenpox is spread through coughing, sneezing, or touching the blisters or mucus of the infected person. So, Miss Teresa, let me ask you this. Were you vaccinated?
If I was vaccinated against chickenpox? No, nurse, I wasn't. I don't think so.
So once you're vaccinated, chances of catching chickenpox is very low, and even if you do contract the virus, the symptoms are very mild.
Okay, that's why me catch it so bad.
So do you have any relatives or children living with you right now?
Yes, nurse. I have a 1-year-old.
Oh, you have a 1-year-old. Is he vaccinated?
No, him not get vaccinated for it yet either.
Oh, well, it's best to get him vaccinated as soon as possible and ensure that you isolate yourself from others so they aren't at risk of contracting the virus as well.
So that means I have to go make him stay with him at least papa for the time then. Alright, nurse. Me I go make him stay away. Yeah, and you say must stay away from everybody else until me get better. Yes, man. And me must bring the baby go get vaccinated as soon as possible too.
Yes.
Alright, nurse. I will do that. Yes, man. Thanks. Thanks for your time.
You're welcome. I hope you get better soon and thanks for calling. Okay.
What, Melodicia? Girl, you good?
Girl. Yeah, man, me good. How you? You good?
Yeah, man, me good now. But me I tell you, say that chicken pox something there and a something to play with.
Be glad to hear that, man. So how you still know you did call the nurse?
Girl, yeah, man. I did call the nurse and she tell me what to do and tell me all about the chicken pox.
Okay. Boy, I told you tell me how it mash up. Me no want to check the something there, girl.
Yes, man. Girl, me would advise you to get vaccinated from now so you don't catch it. You don't want them something that mess up your clean skin, girl. Where you want to wear your pretty clothes, them go party and something.
You know what true though? Monday morning, early Monday morning, I have to get vaccinated.
Yes, man, me alright now. You know my skin come back clean and nice. So, we will link up, yeah? But try and get vaccinated.
Right, make me keep you up to date and we talk here, we link up. Yeah, girls, so take care.
Hi guys, welcome to Group 5 presentation. In our presentation, we will be focusing on the theme to vaccinate or not vaccinate with the topic Varicella Zoster, get a stick before the itch. Our group members are Ladisa Golden, Tashira Sinclair, Kelly Bassier, Teresa Richards, and Shanti Smith.
Everyone, my name is Ladisa Golden and I will be telling you about the microorganism and causative agent of the chickenpox infection. Now, what is chickenpox? Chickenpox is an infection that is caused by the Varicella Zoster virus. Now, the Varicella Zoster virus is a DNA virus that is a family or is a part rather of the herpes group. Now, the incubation period for the Varicella Zoster virus is 14 to 16 days after being exposed to the virus. However, chickenpox is highly contagious to persons who have never had the disease or who have never been vaccinated against it. Now, the majority of persons who have had chickenpox or who have been vaccinated against it are said to be immune to the infection. Therefore, if a patient has been vaccinated against chickenpox and still get the infection, their symptoms are much milder. In most cases, for persons to be infected a second time by the chickenpox infection is relatively rare.
Hi, my name is Shanti Smith and I will be doing the portals of entry and the portals of exit for chickenpox. Portals of entry. Chickenpox is transmitted from one person to another by droplet infection. Most patients are infected by face-to-face contact, and the portal of entry of the virus is through the respiratory tract. Portals of exit. The virus never usually leaves the host, but hides in a latent state, not causing any illnesses. However, chickenpox can leave the body to infect another person through coughing, sneezing, or directly touching the blisters, saliva, or mucus of an infected person.
My name is Kelly Bassier and I'll be telling you all about the transmission of chickenpox. Firstly, chickenpox is a highly contagious condition. It spreads easily to persons who have never been infected with the virus and have not been vaccinated against it. It can be spread via direct contact with an infected person. Therefore, direct contact with blisters, saliva, and mucus of the infected person, as well as it can be transmitted by fomite. Fomite are things such as money, door handles, sheets, plates, etc. It can also be spread through the air by sneezing or coughing. A person who has the virus is contagious beginning 1 to 2 days before blisters begin to appear up until they have crusted. It takes about 2 weeks after being exposed to a person with the virus for the exposed person to develop the virus. For most individuals, getting infected with chickenpox once provides immunity to the virus for life. However, this is not always the case. The varicella virus, which causes chickenpox, remains dormant in the body after the first infection, but can return later in life in the form of shingles. Therefore, it would be recommended that persons get vaccinated against chickenpox.
Hello everyone, my name is Teresa Richards and I will be informing you on the precautionary measures and the treatment for the chickenpox disease. There are a few ways in which one can take precaution against contracting the varicella zoster virus, which is the causative agent for the chickenpox disease. The first precautionary measure is to try and stay away from anyone who's infected with the virus by following standard precautions, and this includes negative airflow rooms until all their blisters have dried and scabs have formed. Pregnant women should take precaution as not to contract the virus during early pregnancy, as this can lead to the newborn being at risk of having a life-threatening infection. People most prone to the illness includes those with low resistance to diseases such as newborns, people with AIDS, or people taking corticosteroids, transplant medications, or cancer medications. The best preventative measure for chickenpox is the chickenpox vaccine. The vaccine is a live but weakened form of the virus and is administered subcutaneously. It then causes the body to make antibodies that defends the body from future infections by the virus. The vaccine can be administered alone or in a combination vaccine with measles, mumps, and rubella depending on age. Treatment includes, and in most cases, treatment is directed at relieving symptoms until the illness goes away on its own. Non-medical therapy includes keeping the body cool as heat and sweat aggravates itchiness, applying cool water compresses to the affected skin areas to reduce itchiness, taking daily baths with soap and water, which can prevent bacterial infection. Doctors advise a variety of medical treatments for chickenpox, like antiviral medications such as acyclovir may help if taken early in the course of the illness. They are appropriate for high-risk people, including those with weakened immune systems. Antihistamine, liquids, and pills can aid in easing severe itching. The use of aspirin, however, to lower fevers in chickenpox increases the chance of acquiring Reye syndrome and as such should be avoided.
Hi everyone, I'm Tashira Sinclair and I will be doing the role of the nurse. So the role of the nurse is very important in the healthcare system, and chickenpox is a highly contagious disease that no one would want to catch. So according to CDC 2018, the nurse is responsible to inform everyone, including adults, adolescents, and children, that they should get vaccinated. The primary role of the nurse would be to educate individuals about the virus, inform them of who is most susceptible in catching this virus and how this virus can spread. When caring for an infected person, the nurse should wear proper protective gears when giving the patient a bath, when changing the patient's dressing, and also when changing the patient's bed linen. So chickenpox is spread by respiratory droplets. So airborne precautions are required to protect against airborne transmission of infected agents. In preventing this transmission, it requires personal respiratory protection and special ventilation and air handling. However, the nurse can provide a face mask to the patient and encourage the patient to avoid coming into contact with other individuals and also to practice respiratory hygiene and cough etiquette. So, when a person have chickenpox, it causes you to itch your skin because there are bumps on them. So the nurse should ensure that the patient nails are clipped and encourage them to try their best not to itch their skin, because this can cause further infection of the blisters and it can take a longer while for them to heal. We have come to the end of our presentation, and I trust and hope that you all have learned something. And remember to get a stick before the itch.